Welcome back to another Medtech Snapshot, the one question, one answer digest medical device podcast. With me today is a longtime friend of mine, Shelly Gallup. She's the SVP of RAQA over at Glidewell Labs right here in Irvine, California. And we're going to be diving into a couple different topics today, everything from how do you get a job in the RAQA space? What are some of the things that people at the executive level are looking for? We're also going to get into complaint handling. I know a really fun topic, but an important topic for a business that has commercial product. So stay tuned. All right, Shelly, so we're now getting into more of the strategy as it relates to systems, in particular with complaint handling. So on that end of it, I've noticed that this side of most OEMs business tends to be a little messy, which often can then lead to non-compliance. So can you share with us, how does an OEM build in a solid complaint handling system that can both capture the data correctly, help move it along in the system appropriately, but also downstream provide good customer service? Any thoughts on that?
Yeah, I think you have to really rely on your quality management system. You need to make sure that you have things well documented within your system. One of the big things that I've noticed in companies is people aren't trained on what a complaint is. And they just really need to understand it. I mean, everybody within the company needs to understand what that is. If you go home and you're at a party and you tell somebody about your company and they learn about the product that you have and they say, "Oh, like I had a bad experience with that," that's a complaint, and that's something that needs to be filed. So they need to really understand like what exactly a complaint is. So the big thing we do is we train and make sure that everybody understands what a complaint is. We want to make sure that all complaints are being received because, I mean, at Glidewell, we receive complaints from all over the place. You want to make sure that you're
real quick, can we go back to that? So when you say
Sure.
Received, so my takeaway there is, it could be coming from distribution partners, could be coming direct from the clinicians or the therapists, the physicians, right? So
Right.
How do you capture all of that or make sure it's all being captured?
Oh gosh. I mean, you just have to have a good intake. So you have to have a good team. And you want to make sure that you have a good line to that you're showing the overall company, how the complaints are being received. So you got to have a good intake, a good customer service line for people to call in complaints. We need to have a direct line to the sales team, and we need to make sure that they're trained and that they're sending us the complaints. Because I've worked in companies where the sales team would hold on to the complaints for like 90 days, and then they give us the complaints, and some of them are reportable, and reportable complaints have to be submitted within 30 days. So they're already late.
Right.
So it's really just having that good line of communication, whether it's through customer service, whether it's through us communicating along, with each of our departments and sales and, what have you. That's how we bring in all the complaints and make sure that we have them. So once we have the complaints, you also want to make sure that you're checking like the MAUDE database. That's that's what the FDA is looking at, and that's what they're going to call you out on if you don't file a complaint that's also in the MAUDE database. Yep. So tracking complaints, that's key. And then we want to make sure that we close them on time. We're tracking them. We're closing them within a reasonable amount of time. And to your point of customer service, we want to make sure that we're communicating with the customer and obtaining all of the details, all of the information, and then making sure that we're responding to them and that we're that we are, closing the complaint or reporting it if necessary.
And how important is that closure piece to follow back up with where the complaint originated from? Right? Because it's one thing to solve it internally.
Yeah.
But if you don't provide that follow-up to where it originated from, you could have a party or an entity out there thinking that, well, all right, I gave my complaint and they did nothing with it.
Right. Exactly. So yeah, it's just good customer service and customer satisfaction. They want to know that they're being heard and that you're resolving the issue. So absolutely. The other part of this is you want to make sure that you have a good team. You know, like I said, our complaint handling team and tracking the complaints, that's key. But you want to have like a very knowledgeable and experienced person leading that complaint handling team. In my department, we have transparency. So, you know, we give everybody the same number of complaints to handle. We evenly divide it, but that's put on a board to, they all are holding each other accountable by seeing who's doing the most complaints or who's doing, their share of complaints. They're like, well, why isn't this person getting as many complaints done as I am? So it makes them hold each other accountable. So I think that that's something that's worked with us in making sure that, the work gets done and everybody's not overwhelmed. We also will utilize an outside source that will help us if we have like a spike in complaints. We'll send it to, instead of overwhelming the team by overloading them with, a bunch of complaints, we'll utilize this third-party company that will help us manage those complaints and take that, that extra work for us to keep us in compliance and keep us on track so that we're still meeting our deadlines.